by the COVID-19 pandemic, either through illness or even loss of life, of loved ones, of family. If you're in the healthcare profession like I am, maybe you've had patients die as well. And I thought perhaps it might be a good idea to look back into the history of our country to see if we can observe events in the past and see if that might help us to understand and perhaps go forward in the future with some of the challenges that we're facing as a nation. So I'd like to talk this morning about the 1918 Spanish flu pandemic, which is an incredible and devastating event that swept across the United States about 103 years ago. It affected about a third of the world's population and leading to as many as 100 million deaths across the world. I wanted to start this morning with three separate disclaimers. The first is that I sincerely regret to inform you that I don't have any financial conflict of interest to report. And the second is that any opinion expressed during this lecture belongs to me. And if you hear anything this morning you don't like, you can blame me. Please don't blame Angela or anybody else associated with the University of Notre Dame. And my third disclaimer is that I'm not an infectious disease expert. I'm not a virologist. I'm not an epidemiologist. And in fact, I'm just a surgeon. And maybe in that regard, I'm uniquely unqualified to be giving a lecture about such a complicated topic as this. But I'm going to do it anyway. And hopefully I'll be able to give you some insight into this. So as I've grown older, I've kind of developed an interest in the history of medicine, history of surgery, in fact. And one of my retired partners once told me that in general, that's the first sign that you're losing your mind. But I don't think that's true at all. I think that in my case, my interest in medicine, and really the inspiration for my own career in medicine was this man. This is my grandfather, Dr. Joseph T. Meyer. He graduated from medical school in 1910 in the Chicago area. And my grandfather was also a surgeon, just like I am, and it was almost certainly his history that influenced my decision to go into surgery as well. This photo was taken in 1917, probably at the time when the United States entered the war against Germany, and I was able to find this in his discharge papers that were dated 1919 from the American Expeditionary Forces in World War II. He never did practice surgery overseas, but in fact spent the bulk of his career working as a surgeon at the old St. George Hospital on 76th and Loomis Street on the south side of Chicago, which has been closed for a long time. I was able to look at some of his operative records that one of my aunts gave me, and he actually drained 87 empyemas of the chest, which we'll talk about in a couple of minutes, between 1918 and 1919, which were complications of the influenza epidemic. So in fact, here's an excerpt from one of his surgical textbooks that was dated in 1909 that I have at my home. And it describes the treatment for empyema and how an incision is made in the chest. And sometimes a couple of ribs are taken out and a large drainage catheter is put in there to drain all the pus out of the chest. And I can tell you that I spent maybe the first 7 or 8 years of my career practicing thoracic surgery. And the surgical treatment for empyema of the chest is really not much different now than it was 103 years ago. So before we talked about 1918, I'd just like to briefly mention, for comparison, some of the other great pandemics that have occurred throughout our human species. The first is the current pandemic, and I think there's just so many parallels between 1918 and today, and I want to bring a few of those up during the talk. This is caused by the SARS-CoV-2 virus, and it appears to have originated in Wuhan, China. And this was either as a result of a natural viral mutation, or depending on what you have read or what you believe, it may have occurred as a result of a research laboratory experiment in China that went horribly wrong. The current death toll globally is about 4.7 million people. I read on the news today that in the United States we just passed 700,000 deaths in the United States, which is a terrible milestone, and we hate to see this. We're currently losing about 10 to 14,000 Americans each week from COVID. And what I read several weeks ago, that the death toll will be 800,000 by the end of the year, but I bet it's going to be even higher than that. And that's an astonishing number, really, because I think that all of us can remember, perhaps a year ago, maybe a little longer than that, you know, the CDC and Dr. Fauci, and we're trying to work our way through this, and we were hearing numbers of like 100,000 people, maybe 200,000 at the most, and here we are, we're almost 4 times that a year later. So it's remarkable, it's astonishing, it's incredibly tragic. The next pandemic is the HIV/AIDS pandemic. This probably arose in non-human primates like chimpanzees and baboons in Central Africa. And these were eaten by humans as bushmeat. The virus was transmitted to them. And the first illness associated with AIDS was reported actually in the Belgian Congo in 1959. And early reports in Haiti in the 1960s reported a similar illness. Nobody really knew what it was, but people were getting sick. They were losing weight. They were getting all these immunocompromised infections and dying. And the first cases in North America were identified in New York City and San Francisco kind of simultaneously in 1976. Same type of thing, primarily young men dying of unexplained infections at a young age. And the virus is actually identified in 1984 in the United States by Dr. Robert Gallo, who was a graduate of Providence College. But until then, really nobody knew why people were getting infected or why people were getting sick from AIDS. And the greatest pandemic in recorded history is the bubonic plague, or the Black Death, and this occurred over a 22-year interval beginning in 1331. Interestingly, with this, it was the only pandemic that was caused by a bacteria called Yersinia pestis. All of the other great world's pandemic were all viral in origin. The global death toll of this was staggering. We think about 4.7 million people dying from COVID-19. The death toll here was between 75 and 200 million people. More than 50% of parts of Europe, Central Asia, and North Africa, and parts of Western Asia were completely wiped off the map. And according to what I've read, it took more than 200 years for many of these areas to repopulate, which actually coincidentally was the same time as the rise of the Renaissance, and we can see the bubonic plague characterized in this Renaissance painting here. So today we're going to be talking about the 1918 influenza pandemic. And if we look at modern history, this is the most lethal pandemic in the history of the world. It's sometimes referred to as the forgotten crisis, because after all, it occurred during World War I, and really the emphasis was on World War I. It was on hyperinflation, which occurred throughout the world's economies, particularly in Europe. Also on widespread unemployment and basically economic collapse throughout a lot of the world. So the pandemic is kind of in the background to this, but the two were really interrelated in many ways. The virus stormed across the earth between February 1918 and April 1920. And this virus, unlike SARS, was caused by an influenza A virus, a subtype H1N1, likely of avian origin or bird origin. Ultimately, about 1/3 of the world's entire population became infected. At that time, the population was about 1 billion people. And this resulted in an unimaginable death toll of between 50 and 100 million people. And I think if we extrapolate those figures today, if we look at the lethality of that virus and the increase in our population, we'd be talking about 200 million deaths across the world today instead of 4.7 million. So really, it was a much greater event in terms of public health. The average mortality rate was thought to be around 10%. So 10% of the people who got this were thought to have died. The range was quite large, though. It ranged from 2, 3, 4% in the United States to about as high as 20% in Europe. The most notable exception I found about that was there was a little tiny Alaskan fishing village called Breivik Mission. And in 1918, in the fall of 1918, there were 80 people in this little town, and 4 days later, 72 had died, all from the virus. So there was a giant range of the lethality of this virus. In the United States, this is the greatest public health disaster in American history, if we just talk about our own country. More than 30 million Americans were ultimately infected, which represented about a third of the United States. By comparison, COVID-19 has infected more people. It's infected 42 million people, with about 12% of our population being infected. Overall, in the United States, 675,000 Americans died during the virus. We think it's a lot, and as I said, we just learned today that 700,000 Americans have died from COVID. When we consider the lethality of the virus, with a 3 or 4% mortality and the tripling of the population, we'd be talking about 2.5 to 4 million deaths in the United States alone from this. If you look at all of the military deaths in World War I, in the United States, there were about 116,000 deaths. And more than half of those were actually not battlefield deaths. They were people dying from the flu. And in France and Germany, it was even worse than that. In fact, many historians think that World War I ended because people were so sick of everyone dying of the flu rather than any great battlefield victories. Remarkably, more American civilians died of the flu than all of the military deaths in World War I, World War II, the Korean War, and the Vietnam War combined. It was just unbelievable. So why was the pandemic named the Spanish flu? Well, it turns out this is a misnomer. Spain had remained neutral during most of World War I, and unlike the major powers of England and France and Germany and the United States, there was no news blackout that would have cast the war in a negative light. In fact, the Espionage Act of 1917 and the Sedition Act of 1918 were passed by the United States Congress primarily to put a lid on any negative coverage of the war, to boost the morale in the United States, and actually to help augment the sale of government bonds that were going to use to finance the hostilities in World War I. Spain was subsequently hit hard by the virus, including their king, which is a great photo of this guy, King Alfonso XIII. He apparently was really sick and recovered. But Spain responded by calling it the French flu. And other countries use similar disparaging terms as well. In Russia, it was called the Chinese Katara. In Poland, it became known as Bolsheviks disease. And Spain made many diplomatic pleas throughout the world to the news media, to the government, saying, please, change the name of this. It's killing us. And unfortunately, this fell on deaf ears, and history remembers this, unfortunately for Spain, as the Spanish flu. The exact origin of the influenza pandemic really remains unknown. There's a lot of different theories, and they include China, Northern Europe, and even the United States. With regard to a possible Chinese origin, during the war, the British government hired 140,000 cheap laborers from China. And these men and women were used to build roads, dig trenches, transport the injured, bury the dead. And it was felt that some of these men or women may have carried the virus from China to the Western Front, where the hostilities were being carried out. As far as Northern Europe as the epicenter, there were scattered descriptions of a lethal flu-like illness in Northern Europe, and influenza outbreaks were noted in British field hospitals in northeastern France as early as 1915, 1916. And I think of most interest to Americans, the medical officials from the health department in southwest Kansas and Haskell County first reported a very virulent form of illness. Really nobody understood it as early as January of 1918. And the beginning of the pandemic across the world is officially recognized as being on March 4th, 1918, with the index case being a young recruit by the name of Albert Gitchell, who was an Army cook at Camp Funston in Fort Riley, Kansas. The virus spread rapidly throughout the 54,000 troops at Fort Riley, and within several weeks, 1,500 servicemen at Fort Riley had been infected by this. The virus spread rapidly throughout the United States after that. It's thought primarily by massive troop deployment across the United States, as we can see in this transport train, loaded with American troops. And these trains were largely bound for Atlantic seaports for the troops to go over to Europe. And the seaports were in New York City, they were in Hoboken, New Jersey, Baltimore, Maryland, and Boston, Massachusetts. By mid-March, only like 2 weeks later, the virus had arrived and was reported on a very crowded waterfront in Queens, New York, as we can see from this astonishing picture here. And by late April, and this is only a month after that, the virus had spread to the military port city of Bray, France, as we can see here on this map, here in the northwestern corner of France. And all of this troop movement took place in incredibly crowded conditions. And we can see all these guys just completely jammed together on this trip, on this boat. And most historians now agree that this massive deployment of troops being transported all over the place, across the Atlantic, from France to England, England to France, from the continent to West Africa. This is probably the most important factor in the rapid spread of the 1918 influenza pandemic. So what were some of the other factors that influenced the transmission? Well, it's likely that crowded military camp conditions like Camp Funston, which we can see here, certainly would have promoted the spread of the virus, especially when the guy who was reported as being the index case was a cook who was charged with preparing and handling the food for everybody in the camp. So the virus went from the military now to the civilian population. And this was primarily by all of these deployed troops that were traveling across North America and Western Europe, and coming in contact with multiple civilians. We can see this photograph taken of downtown Nashville, Tennessee. You can see all these young men being deployed and marching off to war, and all the citizens of the town cheering them on, and everybody was passing the virus back and forth to each other. Harsh weather conditions may have played a role as well. Ice core samples taken from the College Glacier in the Swiss Alps suggested that conditions in Northern Europe and Western Asia were particularly cold during that time in the war, and this may have affected the conditions that were ripe for transmission of the virus as well. World War I was also characterized by the adaptation of trench warfare to the battlefield. And the harsh reality is that trench warfare created conditions that were cold, wet, crowded, must have been unbelievably unsanitary. And we can see this in this, what I think is a very grim picture of the German military crammed into a trench on the battlefields in southern Belgium. The widespread use of toxic chemicals as a military weapon unfortunately saw its first large-scale use during World War I. We can see the downward spread of all these horrible chemicals drafting across the battlefield in this aerial image of a German gas attack, which I think is just astonishing. And all of these toxic agents were incredibly irritating to the skin. We can see the terrible burns this young Canadian soldier has all over the body as a result of a mustard gas attack. But in addition to the skin, they also damage the respiratory epithelium as well. And it's thought that this injury to the respiratory epithelium may have created conditions in the lung that aggravated the lethality of the influenza virus. And this led, of course, to the widespread use of the gas mask for World War I during the first time for protection against all of these horrible poisonous fumes. So we've seen with the COVID pandemic that there have been multiple surges, probably at least 2 or 3. And the 1918 influenza pandemic was likewise characterized by 3 separate waves. So in the first wave here, and this is in the summer, early summer and spring of 1918, it was thought that maybe the worst was over, but the virus roared back to life during the late fall in October and November. And this was responsible for the bulk of deaths worldwide and also in the United States. In fact, during the month of October 1918 alone in the United States, there were 168,000 deaths in 1 month in the United States. And we look back at COVID, we've had 3,000, 4,000 deaths a month, 168,000 in 1 month in a country 1/3 the size of where we are now. So what was it about the 1918 flu that was particularly lethal, especially among healthy young people. Well, if you look here, this is a black and white graph of the normal influenza, and it's typically U-shaped. And what that means is that the people that died were typically the very young and the very old. And that's a typical flu even now, the same pattern. In the 1918 influenza, this is depicted in this red W-shaped area. And this is unique in the way it caused disproportionate deaths in this young group of people. And in fact, the civilian death rates in the United States in people between the ages of 18 and 35 was 25 times higher than what would have been predicted. And if we compare this to the COVID-19 pandemic, this is old data from the CDC, but we can see that there's disproportionate mortality in this, but primarily related to advancing age. We really didn't see the deaths in young people like you would normally see with a typical flu. And I think it's too early to say that it may be that the Delta variant, which is now the predominant cause of illness, we might be seeing this reverting to the U-shape. I think it's too early to say for sure. So why was there such a high fatality? We know that there was, but why was there? The most common explanation for this was the unique ability of this particular virus in 1918 to cause release of excessive and uncontrolled release of these pro-inflammatory proteins called cytokines. And these cytokine proteins were identified in the 1950s, and they play a normal role in the inflammatory response in all of us. They help us to heal wounds, they help us to fight infections, they help our bodies to inhibit the growth of cancer cells normally. But when the release of cytokine proteins becomes excessive and disproportionate, you get what's called a cytokine storm. And the cytokine storm results in damage to cell membranes, leakage of fluid throughout the body, ultimately culminating in multi-system organ failure and ultimately death. So the type of respiratory failure seen today in cytokine storms, and after all, if you take care of a patient with COVID, you're going to see this very same thing. This is an identical end response seen in burns, in sepsis, and in trauma. And in fact, early on in my training, back in the 1970s, this phenomenon was referred to as denying lung. And it was coined that by Vietnam combat surgeons who would take care of these young men on the battlefield. They would be in hemorrhagic shock, they would be operated on, they would survive, only to develop unexplained respiratory failure 2 or 3 days later that didn't get better. People thought initially it was pneumonia, but it wasn't. It wasn't fluid overload, it didn't get better with diuretics, and people died. After it was named denying lung, it was kind of expanded, and it was called shock lung. So anybody who was in shock, whether it was cardiogenic, septic, post-infectious, traumatic, it was called shock lung. I think the modern term, which we all are most familiar now, is adult respiratory distress syndrome, or ARDS. So this, for those of you who aren't in the medical field, this is what a normal chest x-ray looks like. And the lung fields here are nice and clean. That allows for proper exchange of oxygen and carbon dioxide throughout the lungs. And this is what a lung with cytokine storm looks like. If we look at COVID-19, if you look at severe influenza, ARDS, the chest x-ray findings are all identical. We can see that the clear lungs have been replaced by these fluffy infiltrates that are filled with fluid. That prevents the proper exchange of carbon dioxide and oxygen, leads to respiratory failure and death. So this patient has COVID-19. You can see what a chest x-ray looks like. This is somebody who's really sick. Here's the endotracheal tube in, they're on a ventilator. They have a high chance of dying. Here's a patient with ARDS lung. They're exactly the same. And the reason it is that we think the common pathway is the cytokine storm that is causing all this. So historical descriptions of what patients look like who had this were kind of what you expected. There was fever, there was cough, there was difficulty breathing, there was weakness. And one of the things I found from my reading was the disease was characterized by being incredibly fulminant, and the people often died within 12 to 18 hours of the onset of symptoms, which is something we just don't see any longer. This is often accompanied by blistering of the skin, by bleeding from the mouth, bleeding from the nose, and I think this is basically a reflection of coagulopathy and multi-system organ failure leading to death. This is no watercolor from 1918. An artist drew this, And the medical term for this is something I've never heard before. It's called heliotropic cyanosis. I don't even know what it means, but I think it's kind of a fancy term for somebody being purple and about ready to die, really, and that's kind of what we're seeing here. So the viral infection in 1918 was sometimes infected by bacterial overgrowth, and occasionally by the development of pneumonia, and also a pus-filled cavity within the chest. And this is the empyema that I referred to earlier on the talk. This is a pus-filled cavity within the chest, and we can see on the chest X-ray here. And this is actually a photograph of the patient, but the pus is actually eroded right through the chest wall and is now underneath the skin. And this is what a surgeon would call empyema necessitans. This is something that requires the service of a surgeon. This needs to be opened up and drained. The organism identified in the 1918 pandemic was actually bacteria. So this bacteria is erroneously referred to as Haemophilus influenza, which is still a term we use now to identify bacteria, but actually this whole thing was a virus. It was just that nobody knew what a virus was in those days. And the effective treatment for this is kind of what my grandfather didn't use these scopes, of course, but the treatment was to open up the chest, drain the pus out, and put these large bore catheters in there, as we can see in the cartoon. So it was generally acknowledged that an unknown airborne pathogen was responsible for this illness. It's just that nobody really knew what it was. There was absolutely no effective treatment available in 1918, and the focus, which was totally appropriate, was on public health and prevention. So wearing a mask was recognized early on to be potentially effective against transmission of the virus. This is a great poster from the health department in Portland, Oregon, urging people to wear a mask. It's kind of a funny looking mask, but maybe it did the job. And this is a notice from the American Red Cross describing how wearing a mask can, quote, protect yourself, but also your children and your neighbor from influenza, pneumonia, and death. So what could make more sense than this? This conveys a sense of common sense. It also conveys a common sense of civic responsibility, I think, as well, which we'll talk about a little bit later as well. In parts of the country, wearing a mask became mandated by law. In San Francisco, violation of local ordinance included a $5 or $10 fine, a $5 to $100 fine, and 10 days imprisonment. So what was the public response to mask regulations? Based on what I can read about 100 years ago, there seemed to be, in general, mostly public acceptance of this. And examples of people that wore this included healthcare workers, like the ambulance workers we can see here. This is a lovely picture from the nursing staff of Massachusetts General Hospital in 1918. Municipal workers, including the Seattle Police Department, London Mail Carrier, even the guy sweeping the streets in New York City, were all kind of on board. And I think in general, the public also seemed to be accepting as well. We can see this in this very stylish couple walking down the street in London wearing their mask. And also a group of men gathered at a barber shop in Denver waiting to get their haircut, all of them wearing a mask. And even sports figures got into the action. This is a photograph from the 1918 University of Washington football team. They obviously posed for this, but they're all up in the line of scrimmage wearing masks. And Major League Baseball, here's the man up to bat wearing a mask as well. So I think you could be cynical and say these were all posed public relations photograph, kind of set up by the government. But I did not find a lot of references to people just saying, I'm not going to do this. But there were some. And here's a poster from an anti-mask meeting, which was in Seattle, Washington. And this was urging people to attend an anti-mask meeting to, quote, protest against the unhealthy mask ordinance. Sound familiar to anybody? Here's a photograph of a man being escorted to jail by the Denver police for refusing to wear his mask in public. So that's enough about mask wearing. What about social distancing? Well, it was thought that fresh air, social, and physical distance could reduce the transmission of the virus, with the idea that getting some distance between you and the next person might give you some protection. So here's a photograph of elementary school children in the Netherlands. So, we're kind of talking about the United States, but all of these things, people are smart around the world, and people in the Netherlands were doing the same thing that we were trying to do here. This is the University of Montana, physics class outdoor. It looks like it was kind of chilly that day, but they were all outdoors. And it was even suggested that riding a bicycle, both for exercise and also as a way to keep away from the crowds, might be a good way to avoid getting the flu. And as we can see in this advertisement here, it was shown to, quote, give you fresh air, new blood, and a new lease on life, which is fantastic, I think. So what about public resistance to social distancing? Do we think this is a new phenomenon? In fact, it's not at all. The best example of a bad outcome related to social distancing was the story of the Philadelphia Liberty Bonds Parade that was held to promote the sale of war bonds to help to finance the war. It's now regarded as the deadliest parade in American history. So against the advice and the pleas of local physicians, the Health Commissioner of Philadelphia, a man named Dr. William Cruzen, allowed the parade to be held on September 28, 1918. 200,000 people showed up for this gala event, and within about 3 weeks, 17,000 people had died of the flu. And about 3 weeks after that, 71,000 people had died in Philadelphia. And this virtually shut down the city. I read that the Archdiocese of Philadelphia kind of engaged seminarians, nuns, and priests. Their job at that time was to gather bodies, to bury the bodies, and perform last rites on all the victims of this crisis. This is a complete disaster. Possibly it could have been, if not avoided, at least made a little bit better than that. So other methods other than mask wearing, social distancing, personal hygiene was recommended, urging citizens to avoid careless spitting on the street, unprotected coughing and sneezing in public. All of this makes a lot of sense to me. And one of the most sensible pieces of advice that I saw was this old advertisement from the old Lifebuoy soap company. I'm not even sure if they still make soap. But they recommended washing your hands multiple times during the day to help to prevent the spread of the virus. And this is a practice that we drill into our surgical trainees every single day of the week. So because public health measures were the only thing that was available, what other things did we have? Well, there was no vaccine for the influenza. How long have vaccines been around? Well, they've been around actually a long time. In 1796, Edward Jenner invented the smallpox vaccine, as we can see in this old painting here. But there was no effective vaccine available in 1918, more than 100 years later, for the flu. In fact, viruses weren't even identified until the 1930s when the electron microscope was invented. And the first flu vaccine was not available until the end of World War II in 1944. What about antibiotics? It was the same problem with antibiotics. They were not available in 1918. And the first commercially available antibiotic was not developed until 1928 by Sir Alexander Fleming. As we can see here, he was a Scottish microbiologist. And it wasn't until about 20 years after that that penicillin was actually introduced into mainstream medicine, once again introduced and was given to the troops during World War II. Had antibiotics been available in 1918, they probably would not have been effective at all against the virus, but they may have been helpful for treating some of these post-viral bacterial infections that occurred. So the use of concentrated oxygen therapy was first developed in the late 1880s, but the use of it in 1918 for use in the treatment of hypoxemia for various pulmonary conditions was not available. One of the earliest references that I could find for the use of concentrated oxygen therapy was interesting by the British Everest expedition a couple years later in 1922. And supplemental oxygen was found to be helpful for people that were climbing to these gigantic altitudes in the Himalayas and were developing hypoxemia and getting sick. So this is a great photograph of George Finch, who was the leader of the British Everest expedition in 1922, wearing a trial apparatus. If anybody is a student of the history of mountaineering, it was only 2 years later that George Leigh Mallory and Andrew Irvine both perished about 750 feet from the summit of Mount Everest, and both of them were found to be wearing the same oxygen apparatus when their bodies were recovered. So really, for patients with established influenza in 1918, there wasn't very much available for treatment at all. There was no such thing as endotracheal intubation, there was no tracheostomy, there was no mechanical ventilation, there was no ECMO or extracorporeal membrane oxygenation, there was no dialysis for patients who went into renal failure. Nowadays we have corticosteroids, we have antivirals, we have monoclonal antibodies. None of this was available. There was some trial use, from what I read, of the use of convalescent serum. And this is taking the blood or the plasma from people who are currently infected and recovered and giving it to someone to help to prevent or ameliorate their infection. And for the most part, I think it was not helpful. And in fact, the CDC, from what I have read, suggests that there were some early trials, you may have read about this, there were early trials of this being used with COVID-19. It didn't work very well with COVID-19 either. So because there was no effective treatment available, an entire industry of these really weird and ineffective treatments was promoted. This included nutritional supplements, like this advertisement advising us to eat more onions, which of course was sponsored by the onion grower, or the use of emergency flu rations in downtown London. And this was in urging us to eat oranges. I don't know if they knew about it, but oranges are high in vitamin C. And about 50 years later, actually Linus Pauling, who's a Nobel laureate for something else, I think it was in physics, but he staked part of his reputation on using vitamin C to prevent colds and flu. I'm not sure if that works either, but it certainly has caught on. There are a whole bunch of other really interesting and quite frankly quack remedies that I came across. I'd just like to share a few. This is Vino's Lightning Cure Elixir. The active ingredient were sodium bicarbonate and citric acid. I think taking these both probably wouldn't kill you, but I don't think it helped either. Milton's Elixir, the active ingredient was sodium hypochlorite or common bleach. Does this sound familiar to anyone? This is a great one. These are Formamin tablets. The active ingredient was formaldehyde, which is what is used to embalm the human corpse. They at least asked the question, can influenza be prevented? The answer was a resounding no, especially using this product. And it probably was neither safe nor was it effective. Other commercial products were developed, including Listerine, which is also in common use. This was invented by a guy named Joseph Lawrence, who was a chemist in St. Louis, Missouri. Listerine contains eucalyptus, carbolic acid. The reason you can't get drunk on it is because there's wood alcohol in it, at least there used to be. Listerine was promoted as an effective prevention against the flu. Here, get the upper hand. Unfortunately, it didn't work. I also read, interestingly enough, that Listerine early on in its marketing was promoted as a wood floor cleaner and also a treatment for gonorrhea. So, what the relationship between a dirty wooden floor and venereal disease is completely unclear to me. But there you go. Finally, various air sanitizers were promoted, including wearing a cloth bag filled with camphor, as we can see here. And these young boys in New York City were wearing this, and camphor is an aromatic oil. And this is the active ingredient found in Vicks Vapor Rub. And when I look around the audience, I see a lot of people here that probably had this smeared on their chest by their mothers when they were little. And I know our mothers loved all of us a lot, but I think Vicks was probably just as ineffective in 1918 as it is now for doing much. So this is, after all, football weekend, so I would be really remiss if I didn't talk a little bit about the effect of 1918 flu on organized sports. Almost all competitive sports in 19 were canceled or at least affected, as we can see here in this completely inappropriate cartoon of some horrible bug wearing a Spanish sombrero. During 1918, the most popular sports were boxing, baseball, and college football. So as a consequence of the influenza virus, the World Series, professional baseball held an abbreviated season, culminating in the World Series being played on September 11th, 1918. And of some interest, this is the only World Series in Major League history that was played entirely during the month of September. The Boston Red Sox beat the Chicago Cubs 4-2. in front of about 17,000 people at Fenway Park. So the Red Sox were led by a young slugger and left-handed pitcher by the name of George Herman Ruth. You may have heard of him here. And Babe Ruth was traded to the Yankees in 1919, apparently because the owner of the Red Sox, a guy named Harry Fraser, was short on cash, so he thought he'd get some cash and trade Babe Ruth, who actually went on to have a pretty good career with the Yankees. You might have heard about that as well. And what became known as the curse of the Bambino, the Red Sox had to wait an incredible 84 years, if you can believe that, to win their next World Series in 2004. It's hardly imaginable, isn't it? But it could have been worse, right? Because the Chicago Cubs actually had to wait 98 more years before they win their World Series title in 2016. And I think this was almost certainly in part related to the curse that was put on Phil Wrigley and also the Chicago Cubs by Sam Sionis, the owner of the Billy Bob Tavern, as we can see here. As far as professional boxing goes, the heavyweight title was held at the sold-out Olympia Arena in downtown Philadelphia on November 6, 1918, remarkably 2 months after the Liberty Bonds parade, if you can believe that. The contest was between Jack Dempsey here, the Manasseh Mauler. The man here was Barney Leibowitz. He went by the awesome professional name of the Battling Levitsky. And Jack Dempsey knocked out the Battling Levitsky in the third round. What about college football in 1918? Well, most able-bodied men at that time were, of course, drafted into military service, and as a consequence, most of the collegiate games were canceled that year, and the ones that were played were often between depleted college teams and various Army and Navy military bases. The highest profile contest that year was the War Charities game that was held on November 23rd, 1918. The University of Pittsburgh, led by their legendary coach, Pop Warner, defeated the Georgia Technical Tornadoes 32-0, with the athletic director being John Heisman. So we saw Jack Swarbrick here, well, we got John Heisman. Pittsburgh was crowned the unofficial national champion in 1918, and old photographs that I looked at the stadium showed that the attendance was really sparse, and astonishingly, most of the people were actually wearing masks in the pictures that I was able to see. So the 1918 Notre Dame football team had an abbreviated season as well, and they compiled a 3-1-2 record that year. They lost to Michigan Agricultural, which is now known as Michigan State, 13-7, and they tied both Great Lakes Naval Station and the University of Nebraska 0-0. And after the game with Nebraska, one of the Lincoln newspapers declared that, quote, neither the Huskers nor the Catholics could batter their way through for a touchdown. Notre Dame was led by their young rookie coach, Newt Rockne. This is his very first season. He grew up in Norway, and as a young child grew up in the Logan Square neighborhood in Chicago. And over the course of his career at Notre Dame, he compiled 5 undefeated seasons and had 3 national championships for our small Catholic school in Northwest Indiana. As we know, he died in a tragic plane crash in 1931. This fellow here is Earl Curly Lambeau. Earl Lambeau grew up in Green Bay, Wisconsin. He played halfback, which at the time was the most important position on the football team for Notre Dame. The following year, in 1919, he actually got a bad case of the tonsillitis and dropped out of school, moved back to Green Bay and got a job working as a shipping clerk for the Indian Meatpacking Company. While he was there, he ran into a guy named George Whitney Calhoun, and they talked for a little while. They decided they would form a football team up there, so they named it the Green Bay Packers. This man here is George Gipp. George Gipp grew up on the Upper Peninsula of Michigan, and he was a running back and kicker for Notre Dame. He was Notre Dame's first All-American, and he was named All-American at the end of the 1920 season. And about 2 weeks after that, he contracted probably a streptococcal pharyngitis, probably got scarlet fever, pneumonia, and died on, I think, like December 14th, 1920, at the age of 25. With regard to influenza on our own Notre Dame campus here, in the spring and early summer of 1918, South Bend and Notre Dame had been largely spared from the ravages of the virus, and this prompted Father John Kavanaugh, who was the president at that time, to declare that we've had very little evidence of the so-called Spanish influenza. This may be due to the fact that the Notre Dame boy, as a rule, is in exceptionally good shape physically. Present company excluded, perhaps I would. But we now know that young people with a robust and healthy immune system were the exact people that were at risk for developing the so-called cytokine storm and dying. And in fact, by the late fall of 1918, 200 cases of influenza were reported on the Notre Dame campus, and 9 students had died. And you may have read also that there was a Catholic nun by the name of Sister Mary Claudine, who worked in the infirmary at Notre Dame, who took care of all these young boys that were sick. She also got influenza and died as well. So the question is often asked, how did this influenza pandemic of 1918 end? The exact reason remains unknown. It may have been related to the reduction in troop movement across the world, less transmission of the virus at that time. In addition, a lot of researchers have suggested that the mutation of the H1N1 virus to a less lethal strain may have been the reason that the pandemic ultimately came to an end. Historians and epidemiologists also believe that people who got affected, 2 things have happened to you, right? Either you got better or you died. People that died were not going to die again, and the people that survived developed the so-called mass immunity, herd immunity or population immunity, a term that we're hearing nowadays with COVID-19. With the modern influenza virus, it's thought to be likely a descendant of or mutation of the 1918 virus. So that now, more than 100 years later, H1N1, or one of its descendants, have become endemic. Endemic means it never really goes away. It keeps coming back every year. And in fact, this is responsible for the seasonal flu. We see it every year in the United States. And in fact, it causes between 30 and 40,000 deaths in the United States every single year. So how are things different now, 103 years later? What have we observed about recommendations for public health, and how has it affected our approach in 2021? My observation has been that I think most people are doing their best. They're doing their best to avoid getting sick. They're doing their best to avoid getting other people sick. But we've also seen a lot of highly publicized resistance to wearing the face mask. And in fact, the CDC, I think, recently reported some data that I think is valid, and showed a reduction in school-aged children passing the coronavirus onto each other by wearing a mask in school. More recently, we've also seen recommendations for social distancing. And I think you may remember in 1968, 400,000 people descended on Woodstock, New York for the music festival. And this was in the height of I didn't know this, but this is in the height of the Hong Kong flu epidemic in the United States, where 120,000 people died. More recently, it seems to me a more deliberate, more aggressive reaction to social distancing has occurred. We see this every single day on our newscast. You can't walk into a gas station or go in the grocery store to buy a loaf of bread without seeing somebody protesting wearing a mask or getting too close to each other. And more specifically, the beaches of Miami, Florida. You may remember this. This is a genius called the Corona Bro. And he told everybody that he was not going to let COVID-19 stop him from partying. Isn't that fantastic? We've also seen the terrible impact of the Delta variant in certain parts of our country, causing our intensive cares to literally burst at the seams. One of my daughters is an ICU nurse, and they don't have room for people. They don't have room for people in the ICUs. They don't have room for people in the hospitals. People are dying. They're having to be sent hundreds of miles to get their medical treatment. And also, 2 months ago, in spite of local recommendations of local health officials, the town of Sturgis, South Dakota, hosted their annual motorcycle rally. They're expecting maybe like 150,000 people to show up. 700,000 people showed up. And 8 days after the motorcycle rally ended, the state of South Dakota reported a 3,600% increase in the number of COVID cases, almost every single one of them by the highly contagious Delta variant. So I'd just like to talk for a minute about my final disclaimer. And that is that I've been watching Notre Dame football for probably 60 years anyway, maybe a little bit less. And I can remember sometime back in the fall, it turns out it was, I think it was November 19th, walking down the block to watch one of my friends' black and white television sets. We watched FRCSC bring the Irish to Spartan Stadium, where they met Duffy Doherty and the Michigan State Partners. And of course, that game ended up as the controversial and wonderful and epic 10-10 tie. And it was only a week later that Era brought his team to the Los Angeles Coliseum, where they met John McKay here and the hated Southern California Trojans, and they completely demolished them, 51-0. So I can speak with a little bit of authority about Notre Dame football, and I can tell you that watching the game last November was one of the best games I've seen like in the last 25 years. It was really exciting seeing Notre Dame beat Clemson in double overtime. It was just an unbelievably exciting game. But this is social distancing in 2020 in South Bend. And I didn't think this was a great look, I have to tell you. And you may recall watching the game, Tony Dungy and Mike Tirico called the game. And when the gun went off and all the fans rushed the field, Mike Tirico didn't know what to say. And finally he said something like, well, here we are at the Notre Dame Stadium. We're in the midst of a pandemic, there's pandemonium. I mean, it sounded really nice. It didn't look very good. And as it turns out, that last fall, when this game was being played, this was just the beginning of the upstroke of the pandemic when many, many people were dying in the United States. And I know a lot of people are going to the game today, and I'm going to the game too. I think the biggest difference between now and last year is the COVID vaccine. I do believe that in my heart. I don't think any of us would be here if the COVID vaccine hadn't been invented. In November 2020, the vaccine was not going to be available for another month or two. So we've talked about public responses to mask wearing, social distancing. What about the promotion of unproven and ineffective treatments in 2021? How do they compare to what we saw 100 years ago? Well, I've seen all kinds of strange recommendations. I'm sure you have as well. There was the very popular recommendation for the combination of hydroxychloroquine, which is an anti-malarial drug, Plaquenil, used in combination with an antibiotic called azithromycin. This was actually even touted by one of our high-ranking government officials. Also, we saw the recommendation for inhaling bleach, inhaling hydrogen peroxide. Both of these sound like a really, really bad idea to me. In addition, I found evidence for eating ash residue from the Taal volcano in the Philippines. There's this really crazy guy in Florida by the name of Dr. Joseph Mercola. He's a controversial alternative medicine guy. He's also very rich, by the way. He talked about the use of liposomal vitamin C to prevent you from getting sick. It's being sold in various forms throughout the country now. More recently, the widely touted use of ivermectin, which is an animal anti-parasitic drug, being used. And lastly, I discovered that for $370, you can go on the internet and you can purchase the 5G BioShield flash drive, and this will protect you from infection transmitted by dangerous radio waves going over your telephone. Who knew? So finally, just a couple of words about what we've learned about historic resistance to vaccination. Is what we're seeing today unusual? Is it unique? It turns out that it's not at all. This image is from a poster distributed in Montreal, Canada during the late 1880s when a smallpox vaccination that broke out in the city caused the province of Quebec to mandate vaccination for everybody. The people in Quebec did not like this at all. They went to the streets, there was rioting, there was bloodshed, there was death, even in our peace-loving country to the north. And you may have seen a similar cartoon, this from the 1930s. I think the sentiments are the same. This is for a similar outbreak of smallpox that occurred in the United States in the 1930s. And this cartoon tells us that misinformation, that fear, that ignorance were the greatest impediments to the acceptance of the vaccine. And in my opinion, and this is only my opinion, I think these sentiments are exactly true in 2021. So it leads me to wonder where the vaccine resistance movement is going even today. And it seems to me that in many ways the resistance movement is more politicized and more hostile every single day. And ironically, this is in the face of the deadly surge of the Delta variant, which is disproportionately affecting certain parts of our country, which in my opinion are woefully under-vaccinated. You may disagree with me, but once again, this is just one of my opinions. So just like in 1918, we're seeing these public health recommendations for thinking about the other guy kind of colliding with these various resistance movements, which have all of their emphasis on autonomy and on civil rights and on what's good for me. So I look back again to 1918 to see if I can draw any inspiration from those who have come before us. People like my grandfather, but also like countless other health policy advocates, doctors and nurses who've helped to take care of these desperately ill people, who labored through the greatest pandemic in our nation's history. And I find that there's remarkable parallels between 1918 and 2021. And I wonder sometimes why people can't look back at what happened in 1918 and learn from the past. Why as human beings do we need to keep making the same stupid mistakes over and over and over again? And I tend to be in full agreement with Mark Twain, who told us many years ago that history doesn't repeat itself, but it often rhymes. And I think it's long past the time when we need to start waging war on our enemy. And our enemy is not each other. Our enemy is not you against me. Our enemy is the coronavirus, which just like in 1918 threatens the health of the entire planet. I tend to be an optimistic person, I think, by nature. And I think that, I think that as a nation, as a global community, I think that we have enough collective wisdom where we can come together, just like in 1918, and come through on the other end of this and get through this COVID-19 pandemic. I think that we've all been bruised by the pandemic, but I feel strongly that we're not going to be broken by it. So I wanted to thank you all for your kind attention. I also want to thank Angela for setting this up, and also to the University of Notre Dame for the wonderful opportunity to deliver this talk today. So thank you.